Welcome, everyone. Good afternoon. My name's Bob Woods. I want to thank you very much for attending our press conference today on 211. I am the board chair of the United Way of Pennsylvania. I am also the executive director of the United Way of York County and have been in the United Way system for some 37 years. During this time, I have certainly seen many great ideas and programs come and go, but none compare to the development and implementation of a 211 call system for individuals in need of information referral services. In 1993, that long ago, the United Way of Greater Atlanta implemented the first Call for Help initiative, which became the nation's first 24/7 information and referral line. Soon thereafter, in 1997, the Public Service Commission assigned the 211 telephone number to the United Way of Greater Atlanta, and the service eventually was renamed to United Way 211. For thousands of communities throughout the country, and now finally in Pennsylvania, 211 has been a godsend. How many of you have attended a meeting about a significant issue in your local communities and someone comes up with a great idea? Hey, let's develop a resource guide to handle the needs of some particular population. That's what we always come to the conclusion. We can always do a resource guide. Well, we have the ultimate resource guide technology can provide, and that is a 211, a 3-digit phone number that provides access to all the resources and services in our local communities. Currently in Pennsylvania, 85% of our population can pick up their phone, dial 211, and be connected to a trained call specialist. While the primary purpose behind 211 is to link people in need to appropriate services, it also serves other functions in the community. In times of disaster, it is used to deploy volunteers in areas where they are needed most. It serves as support to assessing the needs in a specific community. And its database is a huge resource to the service providers in our communities who need to link clients to programs that happen to be outside of their expertise. Local United Ways in our state have made a major contribution to the funding of 211 in their communities. In addition, funding is provided by city and county government, private foundations, private corporations, and other entities that recognize its value. Noticeably missing is an investment from state government. For 211 to reach its potential and to serve 100% of our population, state government must be a partner. 211 is a proven service. It is a best practice. It is an efficient system which can significantly reduce the number of phone lines currently in existence and being paid for by tax dollars. It is also an effective system, as it truly links people in need to the services, all of the services that they may need. Again, I thank you so much for being with us this afternoon. I'd now like to call upon Representative Stephen Bloom, who is the sponsor of House Resolution 49, declaring February 11, 2017 as PA 211 Day. Representative Bloom?
Thank you. Every day, my staff and I talk with constituents in my district who find themselves in difficult health and human service challenges. The good news is that there are many resources available to help these individuals, from government programs to private and nonprofit organizations in our communities. There are so many resources, in fact, that it can very easily become overwhelming for a person to know where to begin to seek help. This is where the 211 service becomes a lifesaver. It's a gateway to all kinds of help. By using this service, individuals can get a holistic answer to their issue rather than a haphazard, piecemeal response that too often only leads them to additional challenges. Unfortunately, we've seen too many of these. These are people who didn't know where to start, didn't reach out for help early enough, or only received a partial answer to their problem for whatever reason. Their basic problem could have easily been addressed, but now it's escalated into a full-blown crisis, which is even more frustrating and requires more costly services. I support creating a public-private partnership between United Way and state government to enhance and bring awareness to the 211 service and to make sure all Pennsylvanians have access. I want to make sure there is a consistent customer experience across the state, that the quality of our 211 service compares with the best in the country, and that our citizens can access help by calling, texting, chatting, or searching the resource database in an app or on the website. I support this idea because I believe we can help prevent more unnecessary crises from happening to our friends and our neighbors. And because there's also an opportunity here to increase efficiency and cost savings in the delivery of health and human services. For example, a study conducted by the Ray Marshall Center for the Study of Human Resources at the University of Texas at Austin showed that the value of after-hours calls is estimated at approximately $55 million over 10 years for individuals and nearly $80 million for agencies over 10 years. The study also found that the value of reducing duplicative call centers and associated database setup, maintenance, and staffing among public and private nonprofit entities was estimated to save about $300,000 for each potential call center setup and another $50,000 per year in operational savings. I look forward to continuing to work with United Way, with my colleagues, and with Senator Brown in the Senate to provide more efficient, comprehensive help for Pennsylvania's health and human services needs through a public-private partnership for 211 in Pennsylvania. Thank you.
Thank you, Representative Bloom. I'd now like to introduce to you Kristen Rotz, President of the United Way of Pennsylvania, to further share with you how PA 211 is helping individuals connect with the services they need. Kristen?
The message we want to make sure gets through loud and clear today is to the public is that it does not matter if your need is to put food on the table for your family, if you need help with rental assistance payments, if you're looking for help to prepare your income taxes, or maybe you're looking for some supports for your elderly parents so that they can remain at home. 211 is a resource for all of these types of needs and more. We're very happy to have the support of Representative Bloom as one of our prime sponsors in the House. We also are very happy to have the support of Senator Brown, who's not able to be here today, but I've heard him talk about this issue, and I just want to kind of share how he sees 211 as a benefit to the state of Pennsylvania. At an event in early January, Senator Brown spoke about the resource fairs that legislators like to organize in their districts and how beneficial it is to their constituents to be able to bring together so many services from throughout the community that can help people find things that they're looking for. He describes 211 as a 24-hour-a-day, 7-day-a-week opportunity for those types of resource fairs. And we see the benefit in that as well. United Way's work to help a lot of different people with a lot of different needs, and we have many partners in our communities who help us do that. We are aware of what's happening in local communities, and we know about things that are being provided not only by government, but by other service organizations and fraternal organizations that may be doing different types of outreach in their community. So although he was not able to be here today, Senator Brown did give us a statement, and he said, quote, "I am pleased to see Pennsylvania join other states in providing this 211 service. The people who answer calls and texts to 211 have access to an extensive statewide database of public and private resources that allows them to help provide and connect our citizens with the services that can help them. As the Appropriations Chair, I am very familiar with the financial struggles the Commonwealth is currently facing. However, I believe 211 is a smart investment that gives our residents a comprehensive resource to find the help they need by leveraging the right private sector resources that provide the best assistance our communities have to offer."
Okay, thank you very much, Kristen. We had an individual that was supposed to be here from the Pittsburgh area to talk about how 211 actually had impacted her, but obviously because of the weather, she was not able to make it. But we do have Ann Fogarose, Pennsylvania's 211 statewide operations director, who is familiar with the situation, and she'd like to share that story. Ann?
Good afternoon, everyone, and I'd like to first share with you Erica's disappointment that she was not able to be here with us today to tell her story herself. Erica is a woman who is the mother of 2 children, the wife of a wonderful husband. She had moved to Pittsburgh after her husband had been the victim of a crime. The family decided to move to Pittsburgh. She found employment and life was going well. They were enjoying time with their young child. Erica lost her job when the client she was working for was sent to hospice due to her medical condition. Erica is a hardworking, vibrant woman who was sure she would find a job very quickly. And as life throws challenges to many, the next job did not come quickly. She was unemployed, seeking work, and ultimately they went through their savings and she found herself and her family with her young child homeless. While as she tells her story, you may have passed her on the street with a sign, "Can you help me? Family homeless." Someone passed her a card with some money, a 211 card that said, "Call 211, maybe they can help you." Erica did place that call to 211, and they were able to suggest some shelters and give her information about what steps she could next take to help her family. Erica did call the shelter, but she asked that I tell you that that was really good and she needed that connection, but she also was surprised when 211 called her a couple days later to do follow-up with her to make sure she was able to connect to the shelter and to offer other assistance to her. She was connected with the shelter where she and her family stayed for a number of months, and they were able to help her with some basic needs. They were also able to provide her with some job leads as well as clothes for job interviews, all because of the call she had placed to 211. Ultimately, Erica worked with a job placement agency that made a referral to her that gave her employment as a tax temp within the 211 agency, which was just luck that they made that referral because 211 had a position opening. So Erica is a strong believer in 211 and how it can change families' lives with the phone number, and knowing those 3 digits are so important to everyone. So I hope that everyone will share the number, 3 digits, easy to remember. And remember Erica, and that families do fall upon hard times, and 211 is here to help them with solutions. Thank you.
Thank you very much, Ann. 211 is about real people that need help and get the help then that they need. I'm very happy now to introduce you to our PA 211 board chair, Nancy Kukovich, who has been in the position for a number of years and has really seen a lot of things moving forward with 211 in our state. And Nancy will make some closing remarks. Nancy?
Thank you, Bob, and thank you all for making it out here on a day like today. Monday felt like spring, not so much today. So as Bob said, I'm Nancy Kukovich. I'm the chair of 211. It's a volunteer position, and in my paid job, I'm the CEO of a nonprofit out near Pittsburgh called Adelphi. Again, I want to thank you all for your interest in 211 and for coming here today to be with us. I'm sorry that Erica couldn't be here, but you did get to hear her story, and I'm going to talk to you a little bit about the kids that we serve and how they use 211 as well. So, they say, especially in this chamber, that all politics is local. Long-time statement. Well, the provision of services to people is local too. We don't for a minute want to say anything but a great big thank you for the federal and state dollars that we get to provide services to people all over the Commonwealth. But on the ground are thousands, hundreds and thousands of nonprofit organizations, some of whom get government funding, some of whom are doing it all with private money. And they work hard at connecting people with the services that they need so that they can go on and live productive lives. 211 is a big piece of that local provision of service. 211 knows what's going on at the local level, and that's really where people need the help. My organization, Adelphi, serves delinquent and abused children from all over Pennsylvania. We have contracts with 62 counties and 150 school districts. Almost all of these children have witnessed some form of violence, sometimes in their own families, and they come to us either in the community or sometimes in foster care or residential with lots and lots of trauma. They come with untreated medical conditions. They frequently come with some sort of behavioral or mental health problem. And we try as quickly as we can to get them back on their feet, to provide treatment, to attend to those things that maybe haven't been treated before. But our big goal is to get them back with their families. And for the most part, no child spends more than about 8 months in the services that we provide. We used to try to get them local phone numbers of agencies that we thought they would use when they went back home. You can imagine what that might have looked like. 62 counties, 140 school districts. Where do they live? What agencies might they need? What are the hours of operation? Is the number that we have still accurate? Now we give each of them the 211 number, and we role play with them so that they understand what it would be like to text or call 211 and ask for assistance. I can tell you that they go home feeling a little more confident, and my staff feels a lot better about not falling through the cracks. They'll actually have the place that they might need to call. So again, thanks all of you for your interest in 211. We look forward to many more stories connecting people to the assistance that they need, and the data that will help all of us target scarce resources to the most critical needs. Thanks very much.
We can take any questions if you'd like to ask them now, or we'll be available afterwards for interviews.
Thank you all.
Thank you.